I'll start with the fussy baby part, and then I'll get to what you do about it. So, number one, children do have different temperaments. Starting shortly after birth, you can notice that some kids are just, they go with the flow no matter what's going on. They're easy to soothe. And a percentage of kids are more difficult. They tend to be fussy. They tend to be more sensitive. I'm told I was one of those infants, and I grew up pretty well. So there is this sort of inherent temperamental difference among babies. Some babies will be fussier. So the question is what to do about them. I think it depends when. In young infancy, there's this colicky period between about 6 weeks and 3 months where almost every infant has some fussiness, but some fussy babies have a lot more. And certainly we wouldn't recommend leaving that child alone to cry ever. You should pick the child up, hold them, rock them. There are various ways of soothing babies that don't necessarily require you to walk back and forth all the time, including swings, automatic swings that can just calm the baby. But you do want to respond to a fussy baby. I think the other time when people say, should you allow a child to cry, is when they are fussing at night, waking up. This is usually later, either at 8 months, 9 months of age, or even at 18 months or later when they start reawakening and crying and wanting their parents to come in. And the question is, how do you handle that? So I would say that, getting back to what Steve said about that's a sleep issue and the baby is fussy, wanting your attention. I think if you follow Steve's good advice, you will avoid most of those pitfalls. But if you have a child who wakes up in the middle of the night, I personally find very few parents really want to let the kid cry it out alone in the dark. And I don't really recommend that used to be called Ferberizing children after Dr. Ferber, who sort of used to recommend that, doesn't recommend that anymore. I think you have to, there are methods to get the child to go back to sleep, which we can talk about later because they're kind of, half-hour discussions, but but we wouldn't recommend, none of us would recommend anymore just letting the kid, closing the door and letting the kid cry it out until they cry themselves to sleep.